Coronavirus care from March 2020 to 2021 cost Huntsville Hospital $40 million. The hospital submitted that hefty amount for reimbursement from the American Rescue Plan, but only received about $2 million in return. That data comes from the Alabama Hospital Association.
WAAY 31's Olivia Schuler joins us live now after talking with the hospital CEO. Olivia, how's the hospital making ends meet now?
Dan, the CEO of Huntsville Hospital, says he's grateful for any amount that the federal government was able to give them. Now, they were reimbursed $2 million, but they were looking for $38 million more than that amount. Samz said to make ends meet, they've dipped into other pools to get that funds. Now, Huntsville Hospital is on a solid financial footing, but Samz says the cost of the pandemic was and still is extraordinary on hospitals. Samz says Huntsville Hospital did not intend to get $40 million back in reimbursement. In fact, $40 million was the total amount the American Rescue Plan was able to allocate between more than 100 hospitals in Alabama. The cost submitted by the hospital to the government included a number of pandemic-related care.
It could be anything from COVID-related testing, the medications that we use to care for COVID patients, and then a big portion of it is the extraordinary staffing costs. So like all hospitals, we've had a lot of nurses either leave or go travel, and we're all having our staffing costs have increased. So some of this is to reimburse for the extra cost of finding staff to do this extraordinarily hard work.
There's been several rounds of COVID-19 relief for area hospitals from March 20 to 2021. Of March, rural hospitals did get an extra boost as well. They received $30 million in separate funding. Now, Sam said the hospital is expecting one more round of funding in the next couple of months. He believes that will be discussed during the next legislative session to get more money for all that COVID-19 care that they gave. Reporting live in Huntsville, Olivia Schuler, WAAY 31 News.
All right, thanks, Olivia. Samz also told WAAY 31 rural hospitals may be feeling most of the weight of the COVID-19 costs.